So obsessive-compulsive disorder, or OCD, is a condition in which intrusive thoughts drive compulsive behaviors to reduce distress. OCD is one of the top 10 causes of disability in the world, and it can manifest in a number of different ways. Some people oftentimes wash or clean in order to reduce fears of contamination, while others oftentimes check in order to relieve a sense that something is not just right. Currently, the first-line treatments for OCD are medications and cognitive therapy, but about 1 in 10 patients don't respond to these standard treatments. And for this reason, there's a need to develop new approaches to treating OCD. Hi, my name is Moses Lee, and I direct the OCD program at the University of California, San Francisco. And today I'm going to talk about a new approach to treating OCD using brain mapping and personalized brain stimulation to treat the patients who have the most severe and treatment-resistant forms of OCD. Deep brain stimulation, or DBS, is a treatment that's reserved for patients with the most severe and resistant forms of OCD. DBS in general is a procedure in which electrodes are implanted into parts of a circuit that's related to a disorder in order to disrupt that disease process. It's commonly used to treat a lot of neurological conditions such as movement disorders like Parkinson's disease, but it also is FDA approved to treat obsessive-compulsive disorder. Currently, there are multiple targets that are being investigated for treating OCD. However, all of them have a success rate of about 60%. And so DBS is a surgical intervention, and the outcomes are still very variable, with 40% of patients still not responding to this treatment. For that reason, there's a need to develop new approaches to improve the efficacy of deep brain stimulation. The approach that we're taking at University of California, San Francisco involves using brain mapping in order to identify personalized targets that can treat somebody with OCD. This procedure basically involves the implantation of multiple electrodes throughout a network of regions that's associated with obsessive-compulsive symptoms. This allows us to map the electrical activity that's related to the circuit and also stimulate a number of regions in order to identify a site that immediately relieves somebody's OCD symptoms. Today I'm going to actually talk about the story of the first patient that was enrolled in our study. She was a 21-year-old woman with very severe and treatment-resistant OCD. A lot of her obsessions involved harm-based thoughts, that she may have incidentally hurt somebody. So she would always check to make sure that they were doing well. The disability that was caused by her OCD was throughout many facets of her life. So she actually was attending nursing school, but actually had to quit early because her OCD symptoms caused her to always be worried that she may have made a medical error. And she actually had to stop driving because she was always afraid that she may have hit somebody on the road. At one point, she was effectively housebound because she wasn't able to see people in public because it would elicit such distress in terms of her OCD symptoms. So to be clear, this is somebody who had never hurt somebody. This is somebody who really wants to do good for people and wanted to be a nurse, but really wasn't able to achieve their goals because of the severity of their OCD. So for this reason, she was a candidate for our personalized mapping strategy using brain mapping. So this is actually a schematic of our first participant's brain. So as you can see here, there were 12 electrodes that were placed in various components of her OCD network. And that allows us to systematically stimulate various regions of her network to try and identify a place in which we could acutely find a relief in her OCD symptoms. Through a systematic process, we eventually identified 2 areas that caused her to have a very immediate relief in her symptoms. During the hospital stay, we were also able to look at the electrical activity throughout the OCD network. And in general, what we found is that when parts of the network were more activated, her OCD symptoms were in general worse. And so this is a network that effectively encodes her symptoms. We then want to understand what the relationship was between the areas that caused her acute therapeutic benefit and want to see how it was affecting this OCD network. And what we found is that the sites that were most helpful for her existed at the structural connections within this network, and they were these nodes that projected throughout different components of this system. Interestingly, what we found is that when we are actually delivering stimulation to these regions, we found that the network was being suppressed. In effect, we were short-circuiting the OCD network. So this is actually an image of the patient's brain here, and in blue represents areas that are suppressed with stimulation, and in red are areas that are being activated. And what you can see is when the stimulation comes on, multiple regions of the OCD network are coming offline. So based upon our results, we developed a personalized deep brain stimulation plan for treating this patient's OCD symptoms. We targeted the same regions using a chronic device at the same locations that were beneficial for her during the hospital stay. And after 6 months after the DBS was turned on, our patient experienced a dramatic relief in her OCD symptoms. Her symptoms decreased from an extreme and severe range of symptoms to a more mild or even remission level reduction in her symptoms. She currently is doing very well. She's back in school in Southern California. She's attending nursing school again. She's able to drive, and she lives independently without the need to depend on her family. So in short, she's able to do the things that are the most important to her. So today I primarily talked about how this brain mapping and deep brain stimulation approach can be used to treat OCD, mainly because it's an interest of mine to basically find new treatments for the patients within my clinic, and I'm the director of the OCD program, so this is where we started. However, these methods could potentially be used to treat other very severe mental health indications. So in my department, we're actually using the same approach to treat a whole range of other psychiatric indications, such as depression and bipolar disorder. So in the future, I'm imagining a way in which we can leverage our emerging understanding of the circuit basis of and the neuroscience underlying these conditions to treat and develop new therapies for people who are the most severe and treatment resistant. So thank you. Thank you.